Welcome to another of my presentations with information and perspective you'll find nowhere else. I just launched my platform 3 months ago and things are really picking up. My third most popular protocol has been for those with constipation. Historically, I resolve constipation within 3 to 5 days, regardless of how many years you've suffered, how severe, and how many other practitioners you've seen. My second most popular protocol has been for anxiety and depression. Again, this is something where in general, people experience an improvement within 30 days. At times a fair improvement, and at times quite significant. I have just completed the anxiety and depression video for all those interested. My most popular protocol thus far has been for SIBO. So let's jump into it and get you more informed. Once you've completed this presentation, you're welcome to visit my website at themicrobiomexpert.com, where you can find an intelligent protocol for SIBO, or you can schedule a consult to personally work with me. So why are so many of my viewers suffering from SIBO? Because it's so very common. Take a look at this table. Pause the video and take a moment to digest the information from this comprehensive paper. Now you have to ask yourself the next logical question. Why do all these conditions have such a high prevalence of SIBO? What is it that they all have in common? The answer? Dysbiosis. Because dysbiosis is rampant in our society. Video after video, I tell you about how dysbiosis is linked to one degree or another to most every health condition we can name. Here's proof. It's the same old story. Too few good actors, too many bad actors. Inflammation within the GI tract, gut permeability, and then systemic inflammation, driving disease outside the GI tract. But first, let's take a step back and review what SIBO is, and then we'll revisit what some of these conditions have in common. SIBO, which stands for small intestinal bacterial overgrowth, is as the name implies. Not only are there too much bacteria in the small intestine, but the composition is different than it should be. More on that later. Although the supposed gold standard to diagnose SIBO is an endoscopic sample from the proximal small intestine, this is impractical. Most people are told they have SIBO from a breath test, in which there is proven wide variability between tests. Symptoms include excessive gas in the upper GI, bloating, pain, constipation, and diarrhea. Sounds like IBS, no? More on that later too. These symptoms are a function of this dysbiotic excessive bacterial presence, causing things like excessive fermentation, excessive deconjugation of bile acids, competition for nutrients, inflammation, and osmotic issues. But what is the root cause? In many of my videos, I always talk about uncovering the root cause, and not just addressing the symptoms. Therefore, in order to resolve SIBO, we have to understand those pesky things like biochemistry, physiology, epidemiology, and the microbiome. That sounds daunting, but luckily, you can just sit back and listen from the expert who understands this world, and I will try to present it to you in a relatable fashion. So how did we get here? It's the usual suspects, really, like a bad diet, antibiotics, and PPIs. It's this lifetime of events, mostly by choice, that drives dysbiosis. Usually when I talk about dysbiosis, I'm referring to the colon and not the small intestine. But the fact is that I've mentioned dysbiosis in the mouth, the stomach, and the small intestine previously. It's all connected. And in SIBO, we have an excellent example of this. What we have is the impaired proper functioning of the GI tract. That's pretty much it. In the case of SIBO, it's more pronounced in the small intestine. Although data does show that some healthy controls fail the breath test too. So let's understand the root cause better. One of the proven main risk factors for SIBO is PPI use, proton pump inhibitors. You know, those drugs you take to block stomach acid. Stomach acid is a very necessary thing, and blocking it has enormous ramifications for the microbiome. I have an entire presentation dedicated to this very important topic, entitled Stomach Acid Blockers and Their Effects on the Microbiome. If you have SIBO, I highly recommend you watch this video next. But for now, here we can see in this figure 1 from the study how those subjects who used PPIs had a much higher prevalence of SIBO as compared to those with IBS. And they both had a significantly higher prevalence of SIBO as compared to healthy controls. So that was just one study. How about we look at many? In this meta-analysis, taking into account 11 studies, These authors showed a significantly increased risk for SIBO in those who use PPI. And in this later and larger meta-analysis, they showed the same. Part of the mechanism which keeps bacteria in check in the small intestine is pH. The PPIs make the pH less acidic, allowing bacteria type and abundance to survive in an area where they previously couldn't. The PPIs also allow bacterial passage through the stomach, bacteria from, say, the mouth or even your food. The PPIs also affect digestion. The stomach and HCl exist for a reason. After chewing, they are the second step in digestion. If you hinder your ability to absorb nutrients, you make them more available for those little critters who can then ferment them. Another thing that is disturbed in SIBO is gut motility. This can happen by what I just mentioned, the reduced HCl malabsorption of nutrients. It can also happen by another thing I mentioned earlier, that of deconjugating too many bile acids too quickly. This can affect digestion as well, which can lead to something called ileal breaking, which is a fancy way of saying that your gut has slowed down due to malabsorption. These bile acids are also another great antimicrobial, keeping the count and number of critters in check in the upper GI. Another related possible factor is that you no longer have a gallbladder. You still have bile, but it's not released in proper quantity during a meal, affecting digestion. Another factor could be another drug I've not mentioned before, opioids. Opioids are known to slow down transit time, which leads us to this study. Here they used a wireless motility capsule to measure the amount of time it took to pass through the GI tract. For those who tested positive for SIBO, it took far longer for the capsule to travel through the small intestine, specifically 6.6 versus 4.2 hours, and the whole GI tract as well, 70 versus 44 hours. That is a big difference. This study looked at both of our topics, motility and PPI use. As you can see, both a slower GI tract and PPI use were both risk factors for those with SIBO. This study did not use a breath test, but a more invasive and accurate duodenal aspirate. In other words, they snuck a tube down the throats of these people and sucked out fluid from the other side of the stomach. Then they measured this fluid for count and type of bacteria. After all, that's what we're talking about here with SIBO, right? Too many bugs and too many in the wrong place, high up in the GI tract for reasons I'm outlining. Well, what did they find? Well, they found too many bugs. They had overgrowth of Candida, which is a fungi, and bacteria. What types of bacteria? Streptococcus, Enterococcus, Klebsiella, and E. coli. If you're familiar with my presentations, these names should ring a bell. If not, that's okay. More on this later. And here in our last transit study, I have the perfect transitionary slide. They had two groups, patients taking PPIs for more than 3 months, and those taking PPIs with prokinetics, it's a drug that makes your GI move faster, for more than 3 months. Of the 147 patients enrolled, SIBO, as determined by a breath test, was documented in 13% of patients in the PPI-only group versus only 1.8% of the patients in the PPI plus prokinetic group. This illustrates that if you do mess up digestion via the mechanisms we discussed, you can reduce fermentation in the small intestine by reducing the time the fermentation can take place. Am I recommending a prokinetic drug? No, of course not. It's an example of root cause. You can see their statement here, which says, quote, chronic acid suppression with long-term PPI leads to hypochlorhydria, which alters the intraluminal environment to facilitate the growth of the bacterial flora in the small intestine and contributes to the proximal migration of colonic microflora, which leads us to dysbiosis in the lower gut. How do we get dysbiosis in the lower gut? With PPI use, with antibiotics, with a bad diet. Remember that first slide, how so many very conditions had high rates of SIBO, and I said that they're all connected by dysbiosis? Well, let's take a look at that. Parkinson's disease was one of those listed conditions. Those authors found that in their meta-analysis of 11 studies, the prevalence of SIBO in patients with Parkinson's disease was 46%, which was far higher than in the controls. Here I have the microbial fingerprint for Parkinson's disease from my meta-analysis of all the human fecal microbiome data available. All of this and more is available in my Parkinson's video. We see classic good guys reduced and classic bad guys increased, like Enterococcus. Escherichia, that's where E. coli comes from, and Streptococcus. But wait, haven't you heard those names before? Well, there's more. Then there's IBD, inflammatory bowel disease, which is Crohn's disease and ulcerative colitis. Our first paper earlier highlighted dramatically higher rates of SIBO in IBD versus healthy controls. Again, we see my meta-analysis determining the microbial fingerprint for IBD. The dysbiosis of IBD again has features in common with the others: a significant reduction in many health promoters and significant increases in many proven opportunistic pathogens, such as Enterococcus, Escherichia, Klebsiella, and Streptococcus. SIBO was also highly correlated with a number of liver problems to include NAFLD and NASH. And once again, we see the microbial fingerprint for the two. And again, we see the same opportunistic pathogens significantly increased in the fecal microbiome of NASH subjects as compared to healthy controls. These bad actors include our now familiar E. coli, Klebsiella, and Streptococcus, along with a new name, Enterobacter. SIBO is also associated with depression and anxiety. The results of this study show that when compared to the non-SIBO subgroup, SIBO patients express specific patterns of personality traits: higher neuroticism, lower extroversion, and a higher state of anxiety and stress. As many people know, there is a huge connection between the gut and the brain, so this makes sense. You can learn much more about this in my presentation entitled Anxiety and Depression, the Gut-Brain Connection. And when we look at the results of my meta-analysis, we get this familiar pattern. In two taxa, which we're seeing a strong pattern for in SIBO, Enterobacteriaceae, that's where E. coli comes from as a family, that's where it resides, and Streptococcus. But the big factor is IBS. SIBO is basically IBS of the small intestine. So what is IBS? It's dysbiosis of the lower gut. But these bacteria from the lower gut can migrate up into the small intestine. So you have a combination of reduced HCl and bile salts failing to properly inhibit colonization, and you have an overabundance of bad actors in the lower gut, IBS, migrating upwards. The health-promoting bacteria in the IBS gut are first reduced in number, and second, they aren't going to migrate up because they are much more oxygen, pH, and bile sensitive. But the bad actors, the names I keep highlighting in this presentation, they are bad actors in IBS in the lower gut, and they are bad actors in SIBO in the upper gut. Some, like Streptococcus, are normal inhabitants of the small intestine, but their overabundance is the problem in SIBO, as well as the presence of the others. And the symptoms of IBS and SIBO sound an awful lot alike, because they are basically one and the same. Have you noticed how a lot of the healthy controls in these studies are also classified as SIBO solely due to the breath tests? But they don't have symptoms. So there is some combination of false positives, false negatives, people who are more sensitive or less sensitive, daily variability in microbial presence and activity, and more. But suffice it to say that many people with a SIBO diagnosis have dysbiosis in the lower gut, and many people with IBS diagnosis have SIBO in the upper gut, whether it's diagnosed correctly or not. For example, in this study, a comparison in breath tests showed that the hydrogen test picks up IBS-D, diarrhea, better than the methane test, which picks up IBS-C, constipation, better. In fact, while the prevalence of SIBO in the study was 36%, none of the patients included in the analysis tested positive for both gases. In other words, if you have SIBO with diarrhea and you did the methane test, you may have been told you don't have SIBO. But if you did the hydrogen test, then it may very well have resulted in a SIBO diagnosis, the opposite being true for constipation. Again, I'm giving you part of the whole picture, but the easy assumption is that you have dysbiosis, both upper and lower. Here's another example of the variability. In Figure 1, you can see in dark blue how those with IBS consistently have SIBO with much more frequency than the healthy controls. However, the healthy controls aren't exactly immune from testing positive for SIBO, at least some percent of the time. This review also explains how methane is correlated with constipation. The subsequent line of thinking here is to kill methane producers. There are really only a couple of these, and they are archaea, not bacteria. But in any event, my philosophy is not to kill, but to nourish the health promoters and let them control the environment. Killing, as with antibiotics, gets us into this mess to begin with. We want a long-term solution which addresses the root cause. And besides, my data tells me that methanogens don't play a large determining factor in constipation. And in our last IBS paper, we can see in Figure 2 that SIBO subjects had significantly more bacteria in the duodenum than the non-SIBO subjects, and that IBS subjects had significantly more bacteria as compared to non-IBS subjects. They state that IBS and PPIs were independently and positively linked with SIBO, just reinforcing our same theme once again. And what bacteria do they find? E. coli, species from Enterococcus, and from Klebsiella. If we now look at our familiar charting, we see the microbial fingerprint for IBS, which includes both diarrhea and constipation. And again, we see significant reductions in classic health promoters and significant increases in classic opportunistic pathogens, like E. coli and Streptococcus. I've emphasized a handful of these bad guys over and over in this presentation, and now let's cover why. To my knowledge, there are only 6 studies which analyze the microbiome in SIBO, and here they are. I'm not just talking about the overall bacterial count, I'm talking about identifying which individual taxa are present within this overabundance of bacteria in the small intestine. For these 6 studies, you repeatedly see findings for Streptococcus, E. coli, and Klebsiella. Less frequently, you see findings for Enterococcus, Enterobacter, and Staphylococcus. I've been presenting the microbial fingerprints for various conditions and highlighting with red circles where these bad actors play a large role in dysbiosis in those conditions. Again, this highlights the connection between dysbiosis from the lower gut and what we see here, dysbiosis in the upper gut. It also highlights that these same players, and there are a few others, are connected to most every condition you could think of. So if you have dysbiosis driving your SIBO, but you also have anxiety or an autoimmune condition or something else, you can begin to see how it's all connected. To take it one step further, we see those same bad actors we just saw, which are prevalent in SIBO in the first column. In column 2, we see which of these same bad actors have been shown to be significantly increased in multiple antibiotic studies. There's a lot of overlap here, no? Then column 3, I have listed which of these same bad actors, prevalent in SIBO, have been shown to be significantly increased in multiple PPI studies. Again, lots of overlap. And we covered earlier how there is no doubt as to the strong connection between PPI use and SIBO. Well, here's a large part of it. It's all connected. I recommend you watch more of my videos. The same themes appear time and again. Once the light bulb goes off in your head, then you'll understand that if the root cause can be established, a solution can be as well. I'd like to use this last paper to highlight my don'ts for SIBO. These authors state not to use Lactobacillus probiotics for SIBO, as it could worsen symptoms. If you're familiar with my presentations, I highly discourage Lactobacillus probiotics in those with dysbiosis, and SIBO is dysbiosis. I would take it a step further and say to avoid all probiotics and fermented foods in SIBO. Why is that? Well, think about it. In SIBO, there are too many bacteria in the small intestine doing things like fermenting. So why would you want to add more, especially if your gut motility is slow? These authors also state that the low FODMAPs diet reduces beneficial bacteria. Yeah, I've been saying this for years. Low FODMAPs is temporary symptom relief with negative long-term consequences. Watch my presentation on this topic. This paper also discusses antibiotics. But again, it's the same thing. Temporary short-term relief with long-term negative consequences. Watch my presentation on antibiotics. I'd also avoid PPIs if they are not medically necessary. And to round out my list of don'ts, although I highly recommend prebiotics, they have to be the right ones. I highly discourage the use of simple prebiotics like FOS, GOS, or XOS. These are snipped up versions of longer, more complex prebiotics. The end result is that they will ferment a lot faster. Well, where? In your small intestine, where there are too many bacteria causing problems like via fermentation. If you have a practitioner recommending one or more of the above, and you've not been getting better, I would seek out someone who knows what they're talking about. Oh, I don't know, like an expert in the microbiome, for example. Listen, I've been in your shoes. You'll discover that when you watch my video on Crohn's disease. I know what you're going through. You go from one practitioner to another. Maybe they say the same thing, maybe they say different things. All too often, if they can't fix you, then it must be your fault. They tell you that it's in your head. They basically tell you you're crazy. I know doctors aren't miracle workers, but such arrogance on their part, that due to their incompetence, you must be crazy. Sure, the whole disease process is crazy. You were once healthy, and now your body is falling apart for reasons you just don't fully understand. You know that many practitioners have failed you before, and so you start to think, well, maybe I am in fact crazy. The key is education. When I was sick, I wish someone had this material for me to watch. It would have saved me a tremendous amount of time, money, and suffering, both physically and emotionally. So watch more of my presentations and ask yourself, does anyone else provide similar information with this level of detail and perspective? I doubt it. You need to understand how so many aspects of your health are connected, to understand how addressing the root cause is best. And when you're comfortable, you can get one of my protocols, or better yet, work with me directly. Work with a man who has dramatically changed many people's lives for the better, both as the former head of medical education for a microbiome firm and in my own. People who were in your shoes, who were feeling hopeless after so many other practitioners had failed them. Years ago, I said no to a number of talentless doctors. I managed my own Crohn's disease after over 20 years with no drugs, no surgery. I lead a normal life with just a few modifications. And this is the reason I am so passionate and dedicated to what I do. I've been in your shoes, and that's why I'm the best at what I do. If you found this presentation informative, I have many more for free in my YouTube channel and also in the Microbiome University tab on my website, themicrobiomeexpert.com. There you can select from a wide variety of topics. And if you or a loved one are struggling with a disease/condition, I have condition-specific presentations as well, along with their microbiome protocols found within its respective tab on my website.